Hello, this is Dr.R.S.Sonawane, psoriasis homeopathic specialist. Today we will know about plaque psoriasis. Plaque psoriasis is the very commonest type of psoriasis and it is found in majority of the patients, almost 80% of the patients of psoriasis who suffer are the plaque psoriasis patients. So plaque psoriasis, for example, last time we have seen scalp psoriasis. So this is beginning in the scalp, later it spreads on the body and the 80% of the people get that is a plaque psoriasis. So in plaque psoriasis, there are large patches, big patches on all over the body, especially on the buttocks, on the back, on the abdomen. So we notice these are the commonest parts where there are big patches and there is a lot of thickness of the skin and excessive scaling of the skin. So this we find in the plaque psoriasis. All those plaque psoriasis looks like very bad whenever we find the patients, but it's our experience that it is also, as compared to other rare types of psoriasis, it's very easily or it's in short time we can cure it, but there is a lot of dryness of the skin, a lot of scaling of the skin, taking of the skin, and cracking of the skin in this plaque psoriasis. So what are the things when one gets this plaque psoriasis? What care one should take? So whenever there is a psoriasis, there is a dryness of the skin, there is thickness of the skin, there is a lot of itching and the falling of the skin is there. So one has to first of all fight with the itching, which is the most distressful cause of the trouble of psoriasis. Yes, is the itching part. So itching is very severe. Why does one get itching? Itching one gets because whenever there is a separation of the skin, so dead skin falls off, one gets the itching. For that, one has to wash his skin regularly, take the baths regularly, and while taking the bath, one must notice certain things. So while taking the bath, the water that one uses, it should be a lukewarm water. It should not be too cold, it should not be too hot, and one should not take the hot showers for a long time, because if one takes the showers for a long time, as much as water that falls off from your skin, it also takes away the water from your body, and afterwards you will notice that this body is more dry. Another thing in plaque psoriasis, when it is spread over all parts of the body, so immediately after bath one has to use the moisturizer, and they say that for itching only one remedy is there, and that is moisturizer, moisturizer and moisturizer. So such importance is there for the moisturizer in plaque psoriasis. And what is the type of moisturizer one has to use? There can be lotions, there can be oils, there can be ointments, but they say the thicker is the better. The thicker. For example, the jelly, the petroleum jelly is one of the best moisturizer. Moreover, it should be applied. The way to apply the moisturizer is within 3 minutes after the bath, because whenever one takes the bath, the pores, the skin pores are open, and they are open for 3 minutes. Afterward, they close. So if you apply the moisturizer immediately after bath, when the skin pores are open, then the moisturizer goes inside the skin and it moistens the skin for a long time and deeply, and you will experience it. But if it is after 3 minutes, then the skin pores close and you are applying the moisturizer on the dead skin, and the effect of moisturization, the softening of the skin, may not be for the long time. So please notice the moisturizer should be applied immediately after bath. And usually I advise the patient that they should take bath twice a day. So in the morning and the evening before they go to the bed. And once if they take the bath at night before they go to the bed, the skin, the dead skin goes off, and they may not get the itching throughout the night, and they can have a good sleep, which is very important. So plaque psoriasis patients should take it. Then what should they do? Because whenever you apply the ointment, it is on the dead skin, external skin. But one needs to moisten the skin should be soft from the inside. So if you want to soften the skin from the inside, one has to drink a lot of water. The psoriasis patient has to drink a lot of water. And drinking plain water, more water, is not sufficient, because while in psoriasis patient there is loss of skin, there is loss of proteins, and there is loss of minerals and the water. So in order to fulfill the deficiency that they have lost in this all this killing. So one has to take the water, one has to take the minerals. How to take the minerals? Minerals is in the soups, vegetable soups. There are antioxidants in all these vegetable soups and salads. So psoriasis patients should also take the vegetable soups, the coconut water that has a lot of minerals that will help the water that drink to retain in the body, retain in the skin, and that will also help them for effectiveness of the medicines in their body. So psoriasis patient, in order to control the itching, they have to drink the water, they have to drink the minerals, and last but not the least is that psoriasis patient in losing the skin, excessive skin production, they lose a lot of proteins. They need proteins, and they have to take the protein in their diet more than the normal person. So you increase your protein intake. In protein intake, you can, those who are vegetarian, they can, animal proteins are the best one, but in those who are vegetarian, they don't take this chicken, eggs, and fish, which is a good protein. But they can take the milk, paneer, and curds, which is very good for the vegetarian people. Moreover, if it is good to take the proteins, but I would advise the psoriasis patients to avoid the red meat, which is harmful, and to avoid the shellfish, which majority of the people they get the allergy to it, and it causes the itching. So shellfish and red meat should be avoided, but otherwise other proteins, those who are non-vegetarian, they can take the eggs, fish, and those who are vegetarian, they can go for the milk and milk products for the supplement of the proteins and all the dals, etc., the vegetarian proteins. So this is a plaque psoriasis. I told you about what to take about the plaque psoriasis. This is Dr.R.S.Sonawane, homeopathic specialist. We are giving you the information about the different types of psoriasis in general, how to take care of psoriasis. If you have really some questions, please do contact us on the numbers below. Go to our website. There is more information. If you have any questions, please give the questions. We'll be happy to answer to you. Thank you.